Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. So if you're new to our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos and contents here on YouTube, and also be able to support us here at our community at DamiRx Care. So what is our topic for today? Our topic of today is 6 rights of medication administration. As a pharmacist, this is very important when it comes to patients taking their medication and taking it the right way, or taking the right medication in order to avoid any safety issues or events in patients that are taking their medication. So this is very important, especially if you're in the healthcare field. So the first medication administration rights that you want to know is right patient. So the first one is right patient. So you want to make sure that the right patient is who you're treating with, the right drug. So you don't want to, give somebody who's not supposed to be taking a particular medication, or you don't want to switch around their medication information, because then this may be detrimental to another patient. So a medication that's beneficial to one patient might be detrimental to another patient's health. So first thing first, you want to make sure that you're treating or discussing the right things with the right patient. So what is the second right? So the second right is right medication. There's so many medications out there that have different side effects that can be very, very detrimental to patients' health. So you want to make sure that you're giving the right patient the right medication. You don't want to give the right patient the wrong medication and then they end up getting side effects, or they end up having a safety event that could have been avoided if the patient has gotten the right drug. So the third one is right dose. So sometimes in the pharmacy, the doctor or, the physician, as you may call it, may write a particular medication for a wrong dose. So I've seen patients who would, have a medication for an amlodipine, and the doctor may write it for like an amlodipine 20 milligram. Meanwhile, the maximum dose for amlodipine is 10 milligrams. So these are stuff that you want to be aware of. If you have any questions, make sure you're reaching out to the concerned healthcare professional or the right healthcare professional in order to discuss if you have a dose issue, because the right dose can be very beneficial and the wrong dose can lead to a patient's death or a worsened condition in that patient. So one of the important things is making sure the patient is getting the right amount of medication they're supposed to be getting. So what is another, the fourth right of medication administration? So that would be the right time. So it's just like giving a patient a diuretic at nighttime, and patient is already having trouble sleeping. Now you've just given that patient a diuretic medication and they have to use the bathroom all throughout the night and they're not able to sleep well. So the right time is also very important in terms of administering a drug. You don't want to give a patient a medication that they're supposed to take early in the morning, for example, omeprazole, which is taken first thing in the morning before the patient has had anything to eat. You don't want to give them after they've had a meal, because then that would decrease the effect of that medication, and the medication won't work as it's supposed to. So what is another right of medication administration? So that would be right route. So you don't want to give a patient a suppository by applying it just on their skin. Yes, the medication might get absorbed, but that is not how it's supposed to be absorbed. So making sure that you're looking out for how the medication is supposed to be applied. If it's a tablet, make sure that you're taking it by mouth. If it's a suppository, make sure it's going inside the anus or given rectally. If it's a topical, make sure you're applying it and not putting it on your tongue. So those kind of things are very important as well. So giving the medication with the right route is very important. So right documentation. So I know as a healthcare professional, this is probably, something you've heard over and over and over again. So if it's not documented, then it's not done. So making sure that you're having the right documentation that, yes, I've given this patient their medication and, I've successfully watched them take the medication and they should be good to go. So making sure that you're documenting it, that way, it's done. If there's any error with the medication, make sure that you're documenting it. That way we can find, there can be ways to go around it in terms of how to correct the error. Is also very important. So I hope I was able to help you in terms of the 6 rights of medication administration, which is very important as a healthcare professional. All right, thank you for watching and please stay tuned.